In the name of God, most merciful, most compassionate, good afternoon. Since the very beginning of the COVID-19 outbreak in the world, the government of Jordan, upon the instructions of His Majesty King Abdullah II, may God bless him, the government of Jordan has taken decisions and measures that led to positive, concrete results in relation to controlling the pandemic and the spread of the infection. Today, we citizens and decision makers have a critical question. Do we still face the threat of COVID-19? Of course, the threat is still there and it is serious. The pandemic is still spread in the world, and now that we are reopening several economic activities and therefore the chance of contact among citizens is increasing, the possibility for the infection to spread is still there and it's still serious. The government is working hard to facilitate and to expedite the reopening of as many economic activities as possible in a planned, well-studied manner, and to pursue the Jordanian example that have been commended by the countries of the world. We learn from the experiences of other countries that started to reopen their economic activities, and we learn from our own stories of success and our own mistakes. We do believe that we can, God willing, set a Jordanian model for the economic activities reopening and economic recovery. However, we need to remain vigilant, especially that we expect that there will be cases of COVID-19 among the Jordanian students repatriated from abroad, and also the repatriates who were Jordanians stranded abroad. And we also expect that in the near future, there will be some Jordanian expatriates who will be coming back to Jordan because their employment contracts expired or terminated and they no longer have livelihoods in the neighboring or friendly countries they used to work at. All of them will be coming from countries where there is prevalence of the pandemic, and therefore we need to expect and to be ready to deal with positive cases and to learn how to deal with them. Based on this situation, the government is going to continue to impose a partial lockdown in the evening and a comprehensive lockdown at the end of every week. And we will intensify oversight and inspection over precautionary measures, especially when it comes to putting on masks in closed spaces in order to safeguard the health of citizens. And the legal measures against anyone who violates these instructions are going to be taken, and they may mount to closing the enterprise that does not comply. Dealing with this pandemic has been a hard test, and the stages and phases included a response and adaptation, and now we will start recovering, God willing. Dr. Omar Al-Razzaz is going to tell us the trends of the government for the stage of adaptation and recovery, because we want to be proactively transparent with citizens. And after the presentation of His Excellency, Dr. Jaber, the Minister of Health, is going to brief us about the cases and the health situation. May God protect you, protect your family, protect your loved ones and the whole humanity from this pandemic. We're at your service and we succeed if you comply. Thank you. In the name of God, most merciful, most compassionate, good afternoon. Ramadan Kareem. During these blessed days, I would like to express my thanks and appreciation to my brothers and sisters, the citizens, because they have been very cooperative and they have been very patient, and that is a fruitful cooperation. The Minister of Health has just told me that for the 8th day in a row, the incidence of COVID-19 in Jordan is 0 within the kingdom. There are 6 cases at the borders coming from abroad, which we're going to which we're going to apply all the measures in relation to quarantine and protocol and so on. However, we always need to be vigilant when dealing with this very vicious pandemic. Today, as you know, the repatriation of our children, the students, and our brothers and sisters, the citizens who were stranded abroad, some of them were on a vacation, some were on a treatment visit or a holiday, we started repatriating them, and therefore we would like to use this opportunity in order to extend our thanks and appreciation for all of those who have been working on this, including our armed forces, national institutions, security systems, our medical staff. All of them are in the front lines, and we're very proud of them. They've been doing so since day one, and they're still working day and night to do their job. And in today's presentation, I'm going to talk about what we have achieved so far over the past weeks and what we are dealing with now and what we're going to deal with down the line in the coming weeks, months, in the coming days, weeks and months. So if you allow me, let's talk about the stages and the phases of Jordan treatment and Jordan dealing with the crisis. For the first stage was response. The immediate response. Every one of us responded very quickly to this pandemic, to this crisis. And His Majesty gave instructions from day one that we should not be late with taking any decision or any measure when it comes to the citizens' health. So we've taken the decisions and the measures. So in weeks afterwards, we started with the stage of adaptation and solidarity, in which we are now at. And now we build on this to go through the third stage, which is recovery and resilience. Please allow me to talk about the details of these 3 stages, because there's a lot of lessons that we can learn from, and there are details in their relation. The immediate response, we all know that this started on 3 axes. We started early with comprehensive lockdown, with enforcing defense orders, providing essentials to citizens on the early days. Everybody worked together, and of course there were mistakes. There were things that were out of our control in certain areas. However, the situation was very serious and it required that we take quick steps. We also needed immediate steps, and also we needed to develop our procedures for random testing, for epidemiological tracing and partial lockdown. The students were not, the citizens were not used to this, the state institutions were not used to this, the administrative governors were not used to this, but we had to proceed and take decisions and apply these measures. Also, when it comes to developing mechanisms for quarantines and treatment, we had to take immediate steps and procedures to pursue those. Weeks earlier, we met with you and we talked about the possible scenarios, all possible scenarios, and you recall that there was a chart that showed the number of possible cases, and the horizontal line was the number of days, and the dotted line was representative of the ability of our health sector to absorb the shock. The first scenario was very scary. We studied it very well. We saw it happen in China, in Italy, and Iran, and other countries. This was a scenario at the peak of which more than 600 cases were registered every day, and that would have weakened our capacity in the health sector, in the medical sector. The second scenario, though, which we also studied, and we found in the different countries in the world, it was less severe. At the peak, it was at 200 cases every day. Of course, much better than the first one, the yellow one. However, what we aspired to achieve, what we wanted to achieve, was a third curve on which we work with you, and we rely on God, and we count on the sense of responsibility of our citizens and the medical staff and the different apparatuses we have. And that is the third, where the peak is 150 cases. And that gives us a margin, an important margin for the medical sector to absorb and to be able to accommodate other illnesses and medical cases. This is what we first talked about in the beginning. And now I shall show you the curve and the scenario that we have been going through in comparison to the three mentioned scenarios. This red line, this red curve, is the achievement of Jordan and the Jordanians under the leadership of His Majesty, who has been following up the details of every procedures on daily basis, and what's being achieved in hospitals and on the field and in all the facilities in the public life. This is a record for Jordan, for the leadership, the wise leadership of Jordan, and for every single citizen who complied with the instructions and followed the precautionary measures and social distancing and everything that we called for, the Minister of Health called for, and all other ministers called for. This level of awareness is the thing that helped us achieve this scenario. We have fully flattened the curve. Now, with all of this achievement, we cannot but pursue this vigilance, because all countries in the world are considering the possibility that there could be a second wave of COVID-19, and therefore this is our collective achievement, your collective achievement, and this requires that we continue to exercise this level of vigilance and caution. So the thing you see to the left is the number of deaths and incidents that were forecasted for every one of these scenarios. God forbid, if you take the yellow scenario, the number of incidents would be more than 26,000 and the deaths 2,000. The blue, 9,561 incidents and 700 deaths. And the green, which we thought that this was the thing that we can achieve, had 4,000 cases and more than 300 deaths. Now, our numbers are 465 COVID-19 positive cases and 9 deaths. May they rest in peace. if you remember the measures that we have been taken day by day, and the cases count day by day. Remember, on March the 26th, the highest number of cases we had on a day was 40 cases. Throughout the countries in the world, once they hit 40, they started escalating. The cases started increasing and escalating, and the curve moved upwards. But thank God we started very strict lockdown and quarantine for 3 weeks. That was very strict. This thorough work and very high level of compliance is the thing. So 3 weeks that led the pandemic to decline. These are very positive results, thank God. However, we need to be vigilant and to be aware of any possibility for numbers to increase. This was the stage of immediate response that we all know of now. We have just started over the past few weeks. We started with the stage of adaptation and solidarity. Adaptation, because this pandemic, the world calls it the new normalcy. This requires adaptation with the new conditions, and also requires measures for solidarity. Adaptation, well, we've seen the measures of remote learning, and thank God it has been fruitful and it has been going well. We receive feedback and we are responding to all feedback we're receiving. Also, teleworking and remote working technicians and staff members and employees can and we're able to work remotely. Of course, not all professions, because some require physical presence on site. And we all know that the gradual reopening of industries, and we all know how the gradual reopening has been going on. And of course, this is still ongoing, yet we have mentioned earlier that there is a possibility for that reopening to stop, decrease, or increase as per the pandemic situation. So this was the first package of adaptation. The second was of a financial economic nature, because the economic impact is significant. The first front line, or the first thing, was to postpone and defer the payments of utilities, social securities, taxes, because current costs need to be cut down for the enterprises and the private sector in particular, in order for them to be able to absorb the shock and overcome it. However, we do realize that there have been other measures to take, and therefore the central bank, much appreciated, took some measures to facilitate facilities by the banks to the enterprises and to individuals, and also reducing interest rates and rescheduling payments. So these are the adaptation measures that we have implemented in order to adapt with this new situation. However, of course, we are a closely related community, a very compassionate community. We have thought of those who lost their sources of income, the self-employed and daily wagers, and therefore thinking of them, we expanded the number of beneficiaries of National Aid Fund. 155,000 new households have been covered, have been added to the National Aid Fund umbrella. Until Eid, the number will become 200,000 beneficiaries, households. Also, the beneficiaries from the coverage of unemployment and the coverage of enterprises by the social security are 11,000. 11,000 new enterprises have joined the social security and therefore benefited from the benefits. So thanks to your efforts and that of the private sector, we established Himmat Watan Fund, where the amount donated to it have been 81 million JDs. The amount has been 81 million JDs. We've received donations from Jordanians, from institutions, and some were at millions and some were at 5 JDs, at the amounts of 5 JDs and 20 JDs by citizens who are in need for every piastre they had, but out of compassion, out of solidarity with the community and their understanding that there are people in need for it, they donated the little they had. So we heartily appreciate everybody who's been donating. And I assure you that we exercise the highest level of transparency and good governance in running and managing this fund. And I assure you that it is subject to external control and audit, and a monthly report about the everything that a monthly report about the fund in terms of revenues and expenditures is issued every month. So this was the stage of adaptation and solidarity, which we started and we're going to continue. Now the third last stage, which we have also started and in cooperation with the private sector, which is recovery and resilience. And here the front line, defense line for enterprises and institutions and startups which will not be able to recover for one reason or another through the programs that we have introduced. We will start a fund, an investment fund for these enterprises who would be able to pursue and to continue if there were investments and funds pumped into their capitals. And now there are studies about this between the central bank and banks, the private sector in general, and of course the government is also participating in these studies. And also there are specific sectoral measures. You know that every sector has been impacted in a way, in a unique way. Therefore, for example, tourism is one of the sectors and industries that were most impacted. Public transportation, road and air transportation, industries, manufacturing other than pharmaceuticals, trade other than food trade. So all of these required specific measures that need to be developed and designed in collaboration and consultation with the private sector. And also we need to motivate moving to a new situation. The whole world is going through a new stage, is moving to a new stage that is different. Moving to digital, to the digital world is now very important. The comprehensive universal health insurance that we've been talking about even before the pandemic now has become more essential. And having universal social security coverage for all employees is also very essential, because we have seen that unemployment fund at the Social Security Corporation serves a lot of our citizens, and we need all to work hard that everybody will be covered under the umbrella of this safety net. As for resilience, we need to be more self-reliant. We need to control government expenditure overcome administrative way of merging institutions and departments together, which is something we had already started to work on before the pandemic, and now it has become this has become an essential need. The Minister of Finance, when he talked about this a day ago, he mentioned that it is very essential to control spendings at this time. And now we also need to employ our youth. Unemployment rate was already high, and now we are working on an integrated program in order to employ youth and avoid any increase in the unemployment rate. Also, resilience requires a national plan and data about the strategic stocks. This has been achieved early in fact, but we really need to update this and depend on the production of energy, the manufacturing of different materials, including medical materials. We're very proud that our the manufacturing industry has proven its competence not only on the national level, rather on the international level. These are the three stages. We have succeeded, thank God, in dealing with the repercussions of COVID-19 through the collaborative work on prevention and preventing this infection and controlling it. As for the economic repercussions, they require the same level of collaboration, partnership, and awareness that everything that happens is going to impact everybody. So whether be it good or bad, how are we going to deal with this reality in the future? How are we going to deal with this new normalcy in the future? We cannot just deny it. We cannot just deny its impact, significant impact, but with our resilience, with our perseverance and best abilities to adapt with this situation. We use our best abilities to create and to produce and to achieve. We utilize our values of compassion and solidarity. This is the state of humanity that the King has always called for, the state of law that applies to everybody, the state of production that unleashes the potentials of everybody, and the state of solidarity that protects everybody. This is the state of humans. Peace be upon you. Good afternoon. Today, there has been 0 cases in the kingdom, and this is the 8th day in a row, as mentioned by His Excellency the Prime Minister. There were 6 cases on the borders. 2 were Jordanians and 4 were from Arab nationalities. The 2 Jordanians were admitted into the hospital for treatment, and we dealt with our brothers, the 4 Arabs, as per the protocols. And 5 cases from Prince Hamza recovered, and therefore the number of patients under treatment in the 3 main hospitals, the founding King University Hospital and Queen Alia and Prince Hamza, there are 59 cases, and today 4,050 tests were conducted. All were inside the kingdom and all were negative. The total number of tests since the beginning of the pandemic was 91,666 tests. 91,666 tests. And you know that the repatriates have started to arrive, and they will be placed in the quarantine locations at the Dead Sea, and they will be followed up as through electronic applications and softwares. The apps have been developed by Jordanians, advanced apps through which we can follow them up, and they can write down their complaints, send their complaints. Soon we will launch a smart app for all citizens. It tells you if you have met or you have been around a person with COVID-19, and it gives you a warning message. All of these apps have been developed by Jordanians, and in fact it's better. They are better than many other smart apps that are used on the international level, as you know, and as His Excellency the Prime Minister said, this great achievement that has been made by the government with you and upon the instruction, the direct guidance of His Majesty the King, was the fruit of effortless collaboration, a harmony of decisions taken by the scientific committees represented by the National Committee of the National Epidemiological Committee and the Directorate of Communicable Diseases and the government. Decisions were always based on scientific grounds. Therefore, they have been more effective, as you have seen. It is our duty, all of us, to protect this achievement. May God protect you, protect this country and His Majesty the King, and peace be upon you.